Hello everyone, myself Preeti Sharma, Assistant Professor in RKGIT Ghaziabad. So in the today's session I will discuss about the general principle and the prevention and the control of cancer. So everybody knows what is cancer. Cancer may be regarded as a group of disease characteristics by an abnormal growth of cells, ability to invade adjacent tissues and even distant organs. Eventually, death of the affected patients of tumor has progressed beyond that stage when it be successfully removed arising from the cells of bone marrow. Means cancer may be defined as a group of disease, means abnormal growth of cells. In the cancer there will be an abnormal growth of cells and ability to invade the adjacent tissues and even the distant organ. The major categories of cancer are carcinoma, which arise from epithelial cells lining the internal surface of the various organs and form the skin epithelium. And next is sarcomas, which arise from the mesodermal cells constituting the various connective tissues, example fibrous tissues, fat and bone. Now the next is lymphomas, myeloma and leukemia. These are some categories of the cancer. First is carcinoma, basically arises from the epithelial cells lining of the internal surface of the various organ. Second is sarcomas, which arise from the mesodermal cells constituting the various connective tissues, and lymphomas, myeloma and leukemia. Now these are the major risk factor for the cancer. First one is diet and nutrition. Next is based on available evidence, the major factor in diet related to cancer are vegetable and fruits, salt and salt preserved foods, meat, refined sugar, fat intake and micronutrients. Now we can come to the prevention and control of cancer, how we can prevent the cancer and control it. These are some points. You have to note down here some points. What are the points that we can control and prevent the cancer? First one is tobacco control, second is alcohol, third is sexual and reproductive factor, fourth is diet, physical exercise and avoidance of obesity, fourth is occupation, fifth is environmental pollution, and sixth is radiation protection, seventh is infection, and next is reduction of exposure to UV radiation. Now one by one we will discuss about the prevention and the control parameters which I told you here. So in the details, first one is tobacco control. Tobacco induced death and disease are preventable. Having current smoking rates would avoid 20 to 30 million deaths before 2025 and 150 million by 2015. Smoking cessation is very effective in reducing risk of lung cancer even in later life, and the greatest saving of life would result if rates of smoking uptake by children and adolescents were decreased. Now the next is alcohol, means alcohol, if the person will avoid the alcohol, there will be a prevention that we can prevent it with the help of alcohol. Control of alcohol require action that is similar to those for tobacco control, and the action that should be targeted towards the individual and the communities include the taxation and the general public education, encouraging the highly vulnerable groups like young peoples to avoid the consumption of the alcohols. Means we have to publicly we have to educate each and every person that you should avoid the alcohol. If there will be an excess, if the youngers are using this alcohol, or they are intaking the alcohol in the large amount, then there will be a chance of cancer. And to reduce or to prevent from the cancer, so all person have to educate that avoid the alcohol intake, encourage them, the highly vulnerable groups like young peoples, to avoid this starting this consumption of the alcohol. Means we have to give the full informations to the individual that they should avoid the alcohol. Now, the next is sexual and reproductive factor. Human that HPV, human papilloma virus, has now been identified as the etiological agents responsible for cervical cancer. HPV prevalence increased with high risk sexual behavior and poor sexual hygiene. Now, the next is education regarding sexual hygiene and safe sexual behavior should be provided for prevention of cancer, cervix. Safe sexual behavior protects women from the risk of cancer by preventing infection with human papilloma virus. Breast cancer is not much amenable to primary prevention to the large extent. Now, we can come next to the diet, physical exercise and avoidance of obesity. Certain basic measures may help in reducing the risk of the cancer. First one is avoid being underweight or overweight. Engage in regular physical activity. All must have to do the physical exercise is also important factor, and I will focus here on the appropriate nutrition diet should be taken. So, each and every person should be should have to take the proper diet, and regular exercise and the physical activity is also must for each and every person. And consumption of alcohol is not recommended, that avoid the alcohol, limit the consumption of salted and deep fried foods. Means there should be less amount of use the consumption of salted food. Person have to use the salted food less, in the less amount they have to use the salt and deep fried foods. Now, the next is occupations. Occupation cancer constitute 5 to 10% of all the cancer, and limit the exposure to potential carcinogenic substance through personal protective and the rotations of the gear rotations of the workers, and magnetize, and we can say the mechanical handling of such chemicals may help in reduction of the cancer from occupational exposures. Means have to reduce the exposure. If the person is mechanically handling the chemicals, if the workers is handling the chemicals here, this handling of chemicals may help in reducing the cancer for occupational exposure. Means if the workers have to limit the exposure should be limit to means in a very less, if we give the less exposure of our harmful chemicals, then there will be a reduction in the cancer from the occupational exposures. Means less amount of exposure should be there. If there is if the person or the workers is not exposure with the means harmful chemicals which is harmful to our body, if there will be a less exposure of such type of chemicals, they may help in reducing the cancer, or we can prevent the patients and control the cancer. Now the next one is environmental cancer. Here you can see maintaining proper vehicle emission standard, promoting alternative source of energy instead of biomass, fuel, taking measures to reduce the emission of CFC, chlorofluorocarbon. CFC stand for the chlorofluorocarbon, CFC. You can see here it means chlorofluorocarbon, chlorofluorocarbon, CFC, chlorofluorocarbon. It means maintaining a proper vehicle emission standard, promoting alternative source instead of, means if reduction of emission of this type of CFC and this fuels, energy which is produced, vehicle which emit out the this type of biomass fuels, if they will be in the maintained form, proper vehicle emissions, then we can reduce the emissions of this CFC. And anti-tobacco measures in home and public places, it will help us to reduce the cancers and it will prevent and control the person from the cancer. Now the next one is radiation protection. We can reduce radiation protection, personal protective device and the dosimeters by personnel engaged in radiology procedures, avoidance of exposing patients to unnecessary X-ray and adequate safeguards in nuclear facilities should be ensured. Means unnecessary radiation or X-ray means if the person come exposure to the radiation unnecessarily, if any patient unnecessarily come in contact with the radiation, then there will be a chance of cancer. So, we have to protect ourselves from the radiations. If there will be a more exposure of radiations, then there will be a more chance of cancer. So, personal protective devices and dosimeter by personnel engaged in radiological procedure, avoidance of exposing patients, means we have to avoid the exposing patients to unnecessary X-ray. I will focus in this point here that exposing the patients, here you can see unnecessary X-ray should be avoided, because radiation will harm, means it will radiation by penetrating the radiation to our body, they will produce the mutations in the cells and that ultimately result in the cancer. It ultimately cause the cancer. If radiation penetrate in the body, that harmful radiation will produce the mutations in this cell and will produce the cancer. So, we all have to avoid the exposure of unnecessary radiations. It is one of the most important we can say the point here to prevent and control the cancer. Now, the next one is infection. The most important infection in relation to cancer prevention in India are HBV and HPV and H. pylori. Vaccination against the HBV, use of universal precautions in healthcare settings, proper sterilization of syringe, needles and other medical equipments, blood safety, safe sexual practice, avoidance of sexual contact and maintenance of genital hygiene, and treating the patient with symptomatic infection of H. pylori and these are some of the important points we have to remember, that vaccination must be required against the HBV, use of universal precautions in healthcare setting. For example, first you can see here the proper sterilization of syringe and needles is required, means in the hospital proper sterilization is required for the syringe and needles and for the various medical equipments which is used in the hospitals, because sterilization is one of the most important. If we not sterilize them, means microbes will grow and they will harmful bacteria, and that will sterilization, I mean to say here that sterilization is one of the most important factor. Here you can see the various medical equipments, blood safety, safe sexual practices, avoidance of sexual contact, maintenance of genital hygiene and treating the patient with symptomatic infection of H. pylori are the mainstay in this regards. Now, here this is reduction of exposure to UV radiations, encouragement of, means how we can reduce the exposure of UV radiations. Encouragement of sun protective behavior is the most effective public health measure to reduce incident of skin cancer in population, especially in children's. Available options include sun avoidance by using the shade, wearing protective clothes and using the sunscreen, means by using the sunscreen and the protecting by wearing the protective clothes which can prevent or which can reduce the exposure of UV radiations. This is one of the most important parameters, that reduction we can reduce with the help of using the sunscreen or by wearing a protective clothes, we can reduce the exposure of the ultraviolet radiation, or we can say UV radiation. Efficacy is expressed through the sunscreen protection factor. This efficacy can be expressed with the help of SPF, that is sunscreen protection factor. Most commercially preparation are presented as having SPF value up to 50 to 20%. So, here you can see the chemo preventions. Though chemo prevention is defined as reduction of the risk of cancer development through the use of pharmaceutical and micronutrients. The breast cancer drug is tamoxifen, reduce the risk of developing a second cancer in the other breast, and a lower risk of colon cancer has been observed following regular use of aspirin and related non-steroidal anti-inflammatory drugs, which reduce the risk of reoccurrence of adenomas. Means chemoprotective, with the help of the chemical we are preventing the, with the help of pharmaceutical agents and with the help, or we can say with the help of drug, we are preventing the cancer. For example, in the breast cancer, drug is tamoxifen, which reduce the developing of secondary cancer in the other breast. Means with the help of using the this cancer or anti-cancer drug, we can reduce the cancer. For example, cisplatin, carboplatin, cisplatin, carboplatin, hydroxyurine, these are some anti-cancer drug. Paclitaxel, doxorubicin, cyclophosphamide, these are some drugs which can be used as a anti-cancer drug to prevent the cancer. And now the next is secondary prevention. Secondary prevention aims at diagnosing the condition at a very earlier and asymptomatic stage and effectively treating it in contact cancer prevented by the two forms. Firstly, by educating the community at the large regarding earlier danger signs so that they could report to the medical facility to further evaluations, and should appear the earlier sign of means in the firstly we have to educate the community that each and every person have to earlier danger sign have to detect, that we have to educate the each and every person that this is a sign of earlier danger sign you have to detect, and you have to report it to the medical facility for further evaluation, and there will be should this sign will be appear. Secondly, we can go for the secondary prevention uses criteria, this certain well established screening procedure as well as the early detection. Now, screening for the breast cancer. Early diagnosis of breast cancer by promoting the breast awareness among all women and clinical breast examinations for women, preferably in the age group 14 to 69 years, should be encouraged, and women should be educated and encouraged to inspect and manually examine all the quadrants of the breast with the flat of hand, and maximum once a month and 10 days after the menstruation period. This is you can see here the mammography is done for the breast cancer incidence. The epidemic increase in breast cancer incidence has led to the introduction of population based mammograph screening. You can see here the mammography. This is for increase in breast cancer has led to the introduction of population based mammography screening, means to screen out the breast cancer we have to do this, we have to see this mammography. The analysis of large randomized trial has shown that in women aged 15 to 69 years, mammography screening can reduce mortality breast cancer, that is up to 25 to 30%. You can see here the 50 to 69 mammography screening can reduce. With the help of this mammography, you can see here 50 to 69 mammography screening can reduce the mortality rate. Mortality rate is reduced for the breast cancer, that is 25 to 30%. Now, for women in the age group of 14 to 49 years, the screening efficacy is significantly less, it is less. So, you can see here for the age group both 50 to 69 and 40 to 49, there will be a significantly less efficacy, but it is more efficacious to reduce the mortality rate between 25 to 30%. Now, the screening for cervical cancer in most developing countries, cytological screening has led to significant reduction in the incidence of mortality from the cervical cancer in the number of developing countries, and the screening should be preferably begins at 35 years of age with the younger age, and it will detected or we can say the progress in the cancer adds to the program cost in the treatment, and strategies such as visual inspection are being tested for use in low resourcing settings where laboratory facility for cervical cytology are inadequate. So, now the next one is screening for the oral cancer. Oral cancer and its precancerous lesions include this of the leukopenic can be leads to detected by the visual inspections of the oral cavity, not only by the trained health workers and the doctors, but a large extent by the subject himself. And this is the population screening for the oral cancer result in the diagnosis of large number of oral precancers and early stage tumors. This is for the prostate cancer. Now, next is tumor markers. These are some of the examples of the tumor markers you can see here, and at last is the tertiary prevention. You can prevent it with the help of radiotherapy, chemotherapy, and these are some references I note down from the various sites. So, hope all understood the prevention and the control of this cancer. Thank you for your patience.